Right, good morning everyone. All right, good morning Queensland. So in really good news overnight, 0 new cases in Queensland of COVID. That's wonderful news, and please keep up that wonderful effort. We now have only 20 active cases, but in the last 24 hours, Queenslanders have come out in their thousands to be tested, over 19,000 tests. So can I thank Queenslanders for coming out and getting tested? That is exactly what Dr. Young has asked people to do, and they are responding in droves. So thank you very much for that. So what we're seeing in the Greater Brisbane area is large amounts of compliance, and people are doing the right thing. And thank you everyone for mainly staying at home. But can I remind people, if you do need to go to the shops to get a loaf of bread or some milk, put your mask on and you can go and do that. If you want to do a bit of exercise, please put your mask on and you can go and do a walk around your neighbourhood. It's a beautiful day out there, so please feel free to go and do those few things. But this has been a really great response from people in the Greater Brisbane community, and we need to keep it up. So Monday 6 p.m. is the day, and we'll be updating you again tomorrow morning at 9 o'clock to see how our cases have gone overnight as well. I can also confirm that 147 close contacts of the hotel cleaner have now been identified, and 112 of those have tested negative. So once again too, some really good news, and Dr. Young will update you about the Mullaney issue, but so far so good, and can I thank everyone for the way in which they have responded. It is absolutely tremendous. Keep up the good work, and together we will get through this. I'll hand over to Dr. Young.
Thank you, Premier. So excellent news overnight, no new cases in Queensland. That is fantastic, and as you've heard, Queenslanders have come forward and got tested. That is brilliant, and the more we can do that, then we know that we don't have those chains of transmission occurring that we don't know about. So please, any symptoms at all, come forward and get tested. Now, there are some people I want and need to come forward and get tested who don't have symptoms. And so I'm going to go through that list again because it is so critical. So people who were at that train that went from Altandi Station to Roma Street at 7 a.m. on Saturday the 2nd of January, please come forward. People who caught the train from Central Station to Altandi Station at 4 p.m. on the 2nd of January. Then anyone who visited Woolworths Callanvale North between 11 a.m. and midday on the 3rd of January. Anyone who visited Coles Sunnybank Hills between 7:30 and 8 a.m. on Tuesday 5th of January. Anyone who went to the Nextra Sunnybank Hills newsagent between 8 a.m. and 8:15 a.m. on Tuesday 5th of January. If you've been to any of those places, it is still absolutely critical. Please immediately come forward. You need to get tested. We need to see you. So far, we've had a total of 187 people come forward related to the cleaner who works at the Grand Chancellor, and 147 of those are close contacts, and we've also had those additional people. 122 of those 187 have already been tested and are negative, which is excellent, and now we have to work through the next 14 days with each of those people. Then we also have the incident that's happened in Mullaney. So thank you already to all of those people in Mullaney who've come forward and got tested. There are a few more people I do want to come forward. So anyone who's been to Caprizio's Italian Pizza restaurant between 6:30 and 7 p.m. on the 6th of January. Anyone who went to the Purple Palette Cellars between 4:15 and 4:25 on Thursday the 7th of January. And anyone who went to the Woolworths supermarket in Mullaney between 4:30 and 4:50 on Thursday 7th of January. Then anyone on that Jetstar flight JQ 570 that arrived into Brisbane at 11 p.m. on the 5th of January. Mind you, we have sent out text messages, emails and called all those people. We have the manifest for that flight. But if there's any concerns there, it was that flight. So it is really important that all of those people, I've just mentioned those venues, anyone who's been there, come forward and get tested, and anyone in the Mullaney area with any symptoms at all, please come forward and get tested. You've been doing that. Thank you very, very much. That's critically important. And I don't know if you'd like questions now. So any questions at this stage?
Dr. Young, last night people who visited the supermarkets at Callumvale and Sunnybank were told to quarantine for 14 days.
Yes.
Why is that, and why are the people who are on the train not asked to quarantine, for example?
Well, because the public health people are assessing each individual case. So far they've assessed those 187, and some people will have been on that train and not in the carriage, not had direct contact, because we've also been working with transport using go-card information and any CCTV footage that's available so that we can work out who's a close contact and who isn't. But the most important thing is individuals shouldn't be making the decision whether or not they're a close contact. They should come forward and then the public health people will make that decision. That's critical. So those lists that I've read out, people won't necessarily be a close contact in all those lists, but they must come forward so we can assess whether or not they are. Thank you. A very important question.
Dr. Young, are you surprised that we've had 0 cases now for 2 days in a row, given this contagious new case rate?
I'm not surprised. I'm relieved, and I think that it shows that Queenslanders are fantastic at responding. We acted very, very fast, and people have responded, and we've tested large numbers, which is really good. It is too early to actually say what this new virus means. This is the first time we've seen it in our community in Australia. We know what's been going on in the UK, but it's very hard to unravel because they came from a different position to us. So this is all about learning every single day, but taking the most precautionary approach possible because we don't want this to get out there. So it's too early to say whether or not we think there'll be cases, there won't be cases. We just have to be very careful, and everyone needs to do what they've been doing. It is wonderful to see every single person in this room, except me, has got a mask on, and I'll be putting my mask on as soon as I walk away from the lectern. And I've been out and about in the streets, and people are wearing masks. This is fantastic, and I thank all of you for getting this message out there. This is so important.
Dr. Young, you mentioned that there were 147 close contacts of this cleaner and 187 people in total have come forward. Does that mean only 40 people, in addition to the people contact tracers have contacted, have come forward from these different locations?
No. It means those other 40 we've assessed and deemed aren't close contacts, but they are contacts, and we need to continue to work with them. But they're not close contacts. So, as I said, this is not an issue really for anyone to concern themselves with. This is our process internally, who we think are higher risk and how we need to manage people. Individuals should not themselves determine whether or not they're a close contact. That's the public health unit that needs to determine that.
How many more people do you think are out there that haven't yet come forward to get tested that could be in contact, either a casual or a close contact?
I have no idea. I do not know how many people attend Woolworths in a certain time frame. I mean, we can make rough estimates, but the most important thing is to get the message out.
Dr. Young, do you have any idea at the moment how the cleaner actually got the infection? Did she actually clean the room where the first case was?
We've got an investigation happening at the moment that will go through all of those issues, because we need to, of course, work through how this occurred, if we can find out, so that it doesn't happen again, if anything has happened that we can stop. We've got to remember this is a very contagious virus, even before the new variant. And this variant is 70% more contagious. So I wasn't that surprised that our first breach was because of this virus. So, and other states have had multiple situations where they've had the virus escape from their quarantine hotel, and in most cases they've not been able to find out how that occurred. So I don't know if we'll find out how it occurred, but we're looking as hard as we can.
Were protocols strengthened once this more contagious virus was in total quarantine?
Protocols generally, yes, are currently being strengthened. So we've extended the time that we require someone to stay in isolation when they're confirmed to have this virus. So it's now going to be 14 days instead of the 10 days before. Now we've got to remember, and this is very complicated, so quarantine is when you don't have the disease. Right, and we require people to be in quarantine for 14 days from when they've been exposed. Right, so there's that. Then, once you've been confirmed to have the infection, prior to this new variant, we required people to be in isolation for 10 days or 3 days after they've had no symptoms, whichever is the longer. So we put that in place, and we have not seen in Australia a single outbreak related to that protocol. So early on, we had tighter protocols till we worked out what was going on, and then we brought in that protocol and we've had no problems. Now we've got a new variant, so we have to review all those protocols, which we have. So we've immediately put in place that people must now remain in isolation for 14 days rather than 10 days, plus have an exit test. So that's now in place. It mightn't stay in place indefinitely. We will review and we'll work out, but just again, that precautionary principle, we've put it in place immediately.
Dr. Young, with the 9 cases that were announced on Friday, have we done genomic sequencing on them, and how many of them may have had the UK variant?
Yes, we have done genome sequencing on all of them. And I've seen some of their results, and I believe one was the new variant, but I'd have to clarify for all 9. I know some of them didn't have enough virus so that we couldn't do the genome sequence, but then that's sort of reassuring because that means it's unlikely they then would spread it. But those that did have enough virus to sequence, yes, we do have those results back.
So do we know how many people in Queensland at the moment have had the UK variant?
I think we're at 7 with the UK variant and 1 with the South African variant.
Given the UK strain and the possibility of other strains, do you think Australia should have a national quarantine facility somewhere for returning travellers coming home?
Well, immediately National Cabinet discussed this issue and they halved the number of people coming back, which I think is a very good thing because it means that we are able to concentrate on that smaller number and put in enhanced processes. So I think that will work very, very well for us.
Given the 0 new cases today, how optimistic are you that the lockdown will end tomorrow night?
Can I see tomorrow's case numbers before I respond, please? Yeah, it's really a short period that we've looked at. Let's see what tomorrow tells us.
Dr. Young, if there are 0 cases tomorrow, is that enough to then end the lockdown? Is that what it's based on?
Let's get the numbers and work out what we're doing.
And just a question, have there been any developments with the gather test?
No, I understand those discussions are continuing between Cricket Australia and the teams.
Well, the Premier said before that 112 of 147 people have tested negative. So does that mean the others' results haven't come back yet?
Yeah. So out of the 187, 122 have tested negative, and we're just waiting results on the rest. And the Premier, of course, was correct. 112 of the 147 close contacts have tested negative, and we're just waiting for the other results. They've been tested, we just have to wait for the results. Yes. But remember, all those people are in quarantine, so they're all safely.
Okay, thank you. Dr. Young, Minister?
So can we thank all Queenslanders, particularly those over Greater Brisbane, for doing an incredible job. over the last 2 days, and we want you to keep that up till 6 p.m. Tomorrow evening. We believe our response is world leading, and we're seeing very positive results as a consequence of Queenslanders stepping up and complying with these directives. We need you to keep doing that. So remember, tomorrow being Monday is a normal work day, but because of this lockdown, we are saying you should be working from home unless you're an essential worker. So again, I remind people they should be staying at home tomorrow and working from home unless they're an essential worker, so that we can get through this 3-day period and hopefully have very positive results at the end. I want to thank the 19,000, we've had 19,152 tests. So thank thousands of Queenslanders who have come out. That's across Queensland. So we saw surges in areas like Hervey Bay and Townsville. So we're seeing people right across Queensland come out and get tested, and that's what we want to continue to see. So please keep coming out and getting tested. We have our clinics operating over the weekend. We have our 8 Mile Plains clinic still operating 24 hours a day, and we've seen people getting tested overnight again at that clinic. And we've had yesterday 77 people from Mullaney come forward and get tested. So thank you so much for everyone who is doing their bit. Please remember, you must wear your mask when you're leaving home. We need to make sure we are taking the strongest measures possible to keep us safe and to get through this 3-day period to see if there is anyone in the community that have it. So as Dr. Young has said, if you've been to any of these sites, please check the COVID website. If you're unsure, if you've been to any of these sites in Mullaney or on South Brisbane or in the city on the train on that particular day, or the Jetstar flight, please come forward so we can assess whether you are a close contact and you need to go into quarantine and get tested. But thank you, Queensland. We've seen so many people wearing their masks and being compliant, and we are so grateful for it, because if us all working together do this, then we can get through this safely and we can get back to opening up the economy as quickly as possible, which is in everyone's best interests.
Thank you, Minister. Deputy Commissioner.
Good morning, everyone. As you've heard, it's been the compliance has been exemplary. So thank you to the community of South East Queensland and those areas that are impacted for what you have done to work with us. Police have handed out over 700 masks since we started on Friday afternoon. There have been some instances where we've had to take action. They've been reasonably low, in fact remarkably low. We've issued 15 penalty infringement notices in the last 24 hours, taking the total to 21 since we started. They've been for a variety of issues, including people leaving home without an exempt purpose, having too many visitors at their homes. There was a party at New Farm yesterday that had to be broken up. And people that are occasionally refusing to wear masks when being given the opportunity. Please continue to offer them to people. And of course we saw that protest activity in the gardens here in the city yesterday, where a 70-year-old person failed to follow directions from police. We've seen much better behaviour at our retail outlets, particularly the shops, so that's great. Please keep that going. We've intercepted over 300 vehicles across the area, which isn't high. But nonetheless, police are out and about there making sure people are doing the right thing and doing intercepts where they need to. That's included 150 on the M1 on the Gold Coast road, and only 4 vehicles have been turned around, so that's very pleasing. And we saw 9 persons on the Gold Coast itself that should have been in Brisbane who had left, who were asked to return to their accommodation on the coast, which they complied with, so no action was taken in relation to them. We've dealt with 270 calls for service, which is pretty low given the population of the area, so that again is fantastic, thank you. And there's been over 250 businesses specifically checked to make sure that they've been compliant. I'll just finish off by saying, look, what we're in here is an operation that is designed to prevent something happening. So the measure of success in prevention, of course, is the absence. So what we've seen is the absence of people doing the wrong thing. So very high compliance, thank you very much. And of course the absence of infections to date, so we hope to keep that going. Thank you.
What happened at the New Farm party?
I understand it was a small party in that area down there where police were called to. People didn't take the right approach, and police were left with no option but to take action against those persons for failing to comply with the Chief Health Officer's directions, which is no more than 2 persons into your premises.
So it wasn't the park, it was a
Sorry?
It wasn't at the park in New Farm, it was in a...
No, my understanding was a party at a residence, but...
How many people?
Oh, I don't have the exact figures, sorry. Thank you.
Oh, actually, just quickly, has anything been sorted out with the $200 mask?
No, as I said yesterday, these decisions are made, and what we have to do is go through a process because our officers, as you're probably aware, issue tickets electronically and other ways. We have to do the work to be able to issue those fines, and that doesn't happen quickly. So what we're doing, of course, as I said yesterday, is we're handing out masks instead of fines, and the community is working very well with us. Thank you.
And I'll just end by saying that I've received a letter yesterday from the Prime Minister about our international cap numbers being reduced to 500, which I think is welcome news. I think all Queenslanders should be happy with that. It means that we'll be able to manage those particular people coming in from those high-risk areas a lot more closely. I think that's very welcome news. And once again, can I thank everyone in the Greater Brisbane region for doing absolutely the right thing. And as I said, we will get through this together.
Are there any concerns about the GABA test? And
Not at this stage. Honestly, everything I'm hearing is that it's very positive, and my understanding is that the grounds are getting prepared. All right?
Premier, 2 days in a row with 0, how does that make you feel?
Oh, very relieved. I think all of us were very anxious, and the fact that everyone's coming out and getting tested, and can I actually give that additional reminder too, if anyone over the next 24 hours has any symptoms, please come out and get tested. Queenslanders have responded with that 19,000 tests over the last 24 hours. We still want to see those high test rates across the Greater Brisbane region. Okay.
With the locations, the list of locations that cleaner had been, if anyone had been to those locations on the day, or is it in the allocated time that they have to come forward regardless of...
My understanding it's the allocated time. So Health have identified those key times, and I urge anyone to look at that website and go back and have a think about whether or not you have been there, and if you are uncertain during those times, go and get tested. It's the safest thing to do for everyone.
Premier, are you concerned about the number of people who actually left to go to the Golden Sunshine Coast from Greater Brisbane on Friday before the lockdown?
Yeah, do you know, we sort of discussed this yesterday. When people did leave, we did issue a reminder to people to stay in their accommodation, just like everyone else is, and abide by the same rules that would be if you left your home in those areas to put a mask on. So, look, hopefully everyone's doing the right thing, and fingers crossed we'll come out of this all together.
Premier, do you think 3 days is long enough to determine whether the virus is in the community or not?
Look, this is world first, what we're doing. The Health Minister said that. I saw some commentary last night as well from a senior medical officer in the UK. I think they were saying they wish that had happened in London. We have taken this decisive action. It's the right thing to do, and let's see what our numbers are tomorrow, and then we'll update Queensland about what the proposed steps forward are following on from that. But so far so good, fingers crossed.
Can you tell us how many hotel quarantine workers there are? And
I don't have those numbers on me, but we can get them for you. But like I said, National Cabinet has addressed this issue very comprehensively. AHPPC is right across it, and we need to we're going to be doing those daily hotel, testing of the shifts to make sure that, that people are safe. I mean, these are jobs that need to be done, but it's not just unique to Queensland, it's happening right across Australia. And our mandatory hotel quarantine is also seen around the world as one of our great strengths. I think they're saying in the UK they're just doing pre-flight testing, but there's no mandatory quarantine. Okay, thanks everyone.
Thank you.
can I ask Dr. Young just about the testing? Is it rapid testing that they'll be doing shift by shift? The saliva testing?
No, we won't be using rapid testing because it's not as sensitive. So we will continue to, because we've got fantastic pathology services in Queensland and in Australia, we'll continue to do that PCR test. But we will be using saliva rather than that deep nasal swab. So everyone knows, the swab going up the nose, down the back, which is a little bit uncomfortable. So we'll do that once a week. But every shift test, the person comes to work, will be saliva, so you put the swab under the tongue. So
And
it's,
that still takes 24 hours or whatever to get back?
yes,
Yeah.
yes.
And will you be looking at testing perhaps hospital workers?
Yes, we've started that discussion for those who are managing the COVID wards.
And Dr. Young, just finally, you said when this all sort of came to a head that there would be an extended list for the cleaner of the places that she'd been. You said this would be the initial list and then there would be another list. And we haven't had another list. Are those the only places that you went?
Yes, she has been extraordinarily helpful, and the reason we got the full list is that people stayed up all night, including her, to work it through. So I'm extremely grateful to her. She has been fantastic in working with us. So we've never had that before, where we've had the list all in one piece when I come out and talk. That's never happened. So it was fantastic.
Right, thanks everyone. See you at 9 o'clock tomorrow.